Women with breast cancer. Breast cancer is rare young women. Fewer than 5% breast cancers are found in the United States occur in women under 40. A diagnosis of breast cancer can be very shocking to young girls. During the life of the usually reserved for the family and work problems, treatment, recovery, and survivorship suddenly takes priority. Predictions. Treatment. The chances of survival of young women diagnosed with early breast cancer are good and many women can expect to live for many years. However, the prognosis tends to be worse in women under 40 than in older women. Breast cancer in women younger, more likely to be a fast-growing, higher grade and an acceptance hormone positive. Treatment. Age. Age itself does not affect the treatment of breast cancer. Treatment is based mainly on cancer stage, tumor grade and tumor characteristics, such as the status of the acceptance hormone HER2 status. Age may also play a role in the choice of treatment options. Menopausal status. Whether or not a woman has gone through menopause. Important ways to treat breast cancer. For example, women with hormone reception-positive breast cancer were treated with hormone therapy. Cancer treatment and interest. Young women being treated for breast cancer may be concerned about the loss of fertility. Chemotherapy may damage the eggs, and both chemotherapy and tamoxifen can cause irregular periods or stop times. Both tamoxifen and chemotherapy and often bring in natural menopause earlier than usual, especially among women who are older than 40 during treatment. This limits the time period of pregnancy and childbirth. Tamoxifen and interest. With tamoxifen, times can return after treatment has ended. However, even in women whose periods return, reduce treatment time window to have children. Because of the risk of birth defects, women should not become pregnant while taking tamoxifen. Tamoxifen is usually taken for many years and over this time a natural fertility treatment, refuse. Chemotherapy and interest. Chemotherapy, loss of periods may be permanent. Women younger than 40 at the time of treatment are more likely than older women to have moments of their return after chemotherapy. The risk of permanent menopause increases every year. Preserving interest. Storing embryos. Before starting treatment, you can take steps to help your ability to have children. Keeping embryos before treatment is one option. In this process, the eggs are collected over several menstrual cycles, fertilized and frozen. Unfertilized eggs can also be frozen and stored. In the past, this method was less likely to result in pregnancy compared to using fertilized eggs that had been set and stored. However, with modern techniques for freezing unfertilized eggs, pregnancy rates are similar. Protection of ovaries. Chemotherapy attacks cell growing. These include not only cancer cells but also cells in other parts of the body, such as the ovaries. Drugs like goserelin, Zoladex, Luprolide, Apron, and Triptylin shut down the ovaries during chemotherapy. Other findings from the research have shown these drugs may protect the eggs from injury and decrease the chances of early menopause. Talking with seed specialist. If you wish to have a child after treatment, talk to your healthcare provider before making decisions about treatment and discuss your options. Meeting with a fertility specialist early. Widest offer various options.